Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Puncture aspiration injection and their reaspiration pair in the hydatid cyst. So we are focusing on the indications as well as the contraindications. So first, let's focus on the indications. So in terms of the indications, it includes the relapse cyst. There is a relapse cyst and there is also the infected cyst and also the cyst which is greater than 5 centimeters, and they are in terms of different liver segments. They are present in different liver segments. Then in patients who refuse surgery, so patients who don't want surgery or where the surgery is contraindicated or where the surgery it is CI, that is contraindicated. Next is where is the indication? It is in terms of the pregnant women. So in terms of the pregnant women, if the children less than 3 years of age. Then comes the WHO. That's the type CE1 and type CE3A. So this is nothing but the transitional cyst. So we saw the indications. Now let's jump on to the contraindications. So under the contraindications, there is a cyst in the lung. So there's cyst in the lung. Next is it involves a cyst communicating with the bile duct. So cyst communicating with that of the bile duct. Then we look at the cyst with multiple septae. So contraindicated in terms of the cyst with the multiple septae. So they are nothing but the honeycomb. So they are nothing but the honeycomb cyst. Next is the inaccessible cyst. So inaccessible cyst. Then comes the hyperechogenic cyst. Hyperechogenic cyst as well as the calcified cyst. Calcified cyst. To learn and grow daily like this, please do subscribe.